สวัสดีค่ะ You are watching Medsphere and today we are going to talk about telemedicine that impact our world. Today is a special day for us. We have Dr. Punanat Thongpim who are specialist in telemedicine.
สวัสดีครับ My name is Dr. Punanat Thongpim, a specialist of telemedicine as Pinky mentioned earlier, and I'm excited to be here.
Well, Nat, we are excited to meet you and we have a lot of questions about telemedicine. And first of all, what is telemedicine?
Telemedicine is just using a smartphone and internet connection. Telemedicine allows people to access medical and health services directly from healthcare professionals, no matter where they are, no matter what they do. It removes the barrier of distance, weather, and even hospital overcrowding. Pinky, I have a question for you. Are you curious about the history of telemedicine?
Yes, Nat, I want to know what the story of this as well.
For what I have learned, telemedicine actually used in the 20th century. Organizations like NASA, they started using video conferencing for remoting patients in space. A great example is the Star Trek project, one of the earliest telemedicine in the world.
Wow, Nat, that sounds amazing. And I have a question. How about telemedicine impact to our world?
For sure, Pinky, that's a game changer for our world. Nowadays, it's widely used in countries with rural areas to support NCD management. Many nations have set up a legal framework like HIPAA law in the US to protect patient data in telemedicine system. To summarize, I'm gonna put a picture of building block of telemedicine good workflow. First of all, the building block consists of three parts. The first is input, which cover the issue such as governance, which are cover the decision-making body that drive progress to goal. A second is regulation standard used to control the quality of services and protect patient data. A workforce include the number of staff and the ability to provide services. Finance needs to plan for sustained system. Infrastructure complemented by technology, information, and communication. The last is services and application should be user-friendly. After we identifying the input, this will lead to a development process that take this issue into consideration. We have digital literacy, we have demand, we have safety, and cross-access coverage. For input and development process, they will lead to the design goal, which are patient-centric approach, reduce hospital visits, and enhance access to medical services.
So Nat, can you briefly explain telemedicine in Thailand?
Well, in Thailand, we use for communication of medical information by licensed doctor from both public and private sections using electronic method to provide consultation and medical advice. And Pinky, I will tell you telemedicine in Thailand evolution year by year. In 1973, Thailand first introduced patient consultation by radio communication. In 1994, the Ministry of Public Health launched the telemedicine project, which includes three main activities: academic conference, teaching, online medical consult, and 2005, Sivarat Hospital became the first hospital in Thailand to implement telemedicine. And in next 2 years, telemedicine services will expand to provincial hospitals. And 2019, the government introduced policy for telemedicine. Pinky, how do you know telemedicine in the first time?
Well, Nat, I do know telemedicine during the COVID-19.
Exactly, because of during the pandemic, telemedicine was used more widely to reduce physical contact and infection risks. After that, 2022, the regulation was updated to include telepharmacy service standards.
That's great to hear that Thailand widely used before the COVID-19 pandemic. And Nat, can you explain us how to use telemedicine?
Let me tell you how to use telemedicine step by step. First, we have to registration. Second, you have to do appointment and preparation. Once appointments are coordinated, patients are informed about the term and method of telemedicine consultation. Treatment rights are verified. And patients have to confirm their identity in application. And doctor gonna provide time for consult, diagnosis, treatment, and rehabilitation. And you have to need to address collection for medication delivery. And in the process of building and receive medication, the finance unit contact patient regarding bank account detail, for service payment and receive medication either by mail or nearby pharmacy store.
Wow, that is fantastic. I understand how to use telemedicine now, and nowadays telemedicine has become an alternative healthcare option for everyone.
Well, Pinky, we talk a lot about telemedicine. As you are a pharmacist right now, can you tell me how different between telepharmacy and telemedicine?
Of course not. That's a great question. I would like to point out that telepharmacy is actually a part of telemedicine, but it focuses primarily on patient medication use, and we as pharmacists have a role in this area. First, I will tell you about definition of telepharmacy so that you can better understand it. On the meaning of telepharmacy according to the Pharmacy Council of Thailand. Telepharmacy is the delivery of pharmaceutical care and related service to patients, including the dispensing of medicine by licensed pharmacists through remote communication technologies.
That's amazing about telepharmacy, Pinky, which is part of telemedicine too. So it would be great if Pinky show me some explain about telepharmacy.
Of course, let me show you some example of platform like this. Ocean Life Telepharmacy Collaboration Farm Care, which provide pharmacists online consult and medicine delivery of over 650 pharmacies across Thailand. In some area, patients can receive medicine within 2 hours. And Nat, can you tell me about the impact on society and the economy?
So what I know the impact on society and the economy, according to the High-Tech Foundation, telemedicine allows doctors to closely monitor patients, improve access to treatment, and reduce patient travel costs. It was especially useful during the pandemic, home isolation, covering 4 areas. First is remote monitoring, second is remote consult, third is remote education, and last is remote care management. That helps relieve hospital overcrowding. People with mild symptoms can consult online before decided that they need to go in person or can reducing exposure, especially during the pandemic.
That a huge impact to our world, which are change our healthcare system get better and better.
Pinky, let's see the impact of DAC system. But I don't know what is DAC system. Pinky, can you reach me out?
Yes, of course. The DAC system consists of 4 main steps. First, DAC selection. Second, DAC procurement. Third, DAC distribution. And the last one, DAC utilization. Telemedicine mostly impacts the step of during distribution and DAC utilization. After that, let's focus on how does telemedicine impact to DAC system.
So, according from this research, show the impact on telemedicine at hospital in Thailand that reported by Health System Research Institute or HSRI. Overall, the number of patients increased rapidly in the first period, the pandemic, right? So, but later that is declined in the fifth, and the appointment adherence rate also dropped slightly over time after using the telemedicine. And the important part showed that there is no adverse event were reported, and both prescribing and dispensing error also decreased too, and it's showing improved safety too. Pinky, let me show you some example the impact to the patient. So implementing the telemedicine system at the diabetes and hypertension clinic in the civilized hospital, the telemedicine was reflecting improvement in disease management and treatment adherence. After getting know the telemedicine, you will find that it still has room for the development. From my perspective, this topic that I'm gonna mention can be improved, such as regulation and standard. We found that there is a lack of operational guidance across professions. So for me, we can use a shared guideline among physicians, pharmacists, and nursing. And moving on to the workforce-based challenges. The challenges is the number and capacity of healthcare providers are insufficient, and our solution is provide a continuous and appropriate training. And regarding the infrastructure, we found that there are poor data connectivity between application and facility. So we need to create a centralized big data system for share information. When it comes to the services and application, right now the current applications are complex and not aligned with user needs. So we need to develop user-friendly application and security more and covering all services process. Finally, in the term of government, the government should enhance public awareness and promote understanding of telemedicine. So, Pinky, that's all for today. Thank you so much for such warm welcoming. Thank you so much.
You're welcome, Nat, and thank you for tuning into Medsphere, where news is fast, fresh, and made just for you. Goodbye.